it's a very important question. That's an emerging trend in spine surgery. What is endoscopic spine surgery? Is it any better? Are there any advantages of doing an endoscopic spine surgery? How is it better than traditional microscopic or open spine surgery? Hi, my name is Dr. Devashish Sharma. I am a practicing spine surgeon working in India, New Delhi, Noida area. So it's a very important question. That's an emerging trend in spine surgery. What is endoscopic spine surgery? Is it any better? Are there any advantages of doing an endoscopic spine surgery? How is it better than traditional microscopic or open spine surgery? So coming to it step by step. We have been doing endoscopic surgeries for a long time as a medical profession. Endoscopes have been traditionally used in stomach, like laparoscope, with the scope which goes into the stomach is called laparoscope. The scope which goes into ureter is called ureteroscope. So the scope which goes into the joint is called arthroscope. All of them are endoscopes, but they are named differently as per the place they are used. So in spine, it's not spinoscope, it's basically endoscope itself, which is used to tackle the problem. Why it is so important? Because it gives a vision of inside the body without actually opening up that area. It is just like saying that we are planting the eye of the surgeon inside the body. So if that eye can go inside, we don't have to open up that much to solve the problem. Second thing, nowadays with 4K graphics and high-end devices, the vision has greatly improved. As it has improved for the cinema, as it has improved for our endoscopes. So now, with an endoscope put in, which is just a 6mm or an 8mm device going into the spine, so just an 8mm hole into the body. So 8mm is like less than my finger breadth. If you look at my finger, you would see that the 1 finger breadth, this is almost 1 centimeter, so less than this finger breadth. Probably this finger will do the justice. This finger breadth dimension of a hole made into the spine, we can go in and we can clear the problem. So how is it different from a traditional microscopic spine surgery? Or how is it different from open surgery? So in open surgery, you have to open up the spine, you have to do a lot of dissection to clean the muscles and then operate. In microscopic spine surgery, you have to open less area, but the same instruments which are used in open spine surgery are used there. So the instruments are not any more smaller. So you still have to do some dissection to allow those instruments to go in. Secondly, they are not designed in a special way. They are traditional open instruments used via microscope. But in endoscopic spine surgery, not only the way of approach changes, also the instrument change. They are designed in the way that they can fit through that 8mm hole and actually solve the problem. An endoscope has a beauty that you don't have to cut through bone to make a larger hole in the bone to go near the pathology. Most of the times you can use a foramen or a hole which is already present in the spine through which the nerves are coming out. You can go through that hole and tackle the problem inside. That allows us an entirely new perspective. Why? Because now bone resection is either eliminated or limited to minimum. That means the spine will be as strong as before surgery. Second, it's a very targeted approach. It is just like surgical strikes. You only go and clear the area which is creating trouble. Third, there is no collateral damage. It will make sure that the spinal muscles, spinal fascia is not cut. We only put a very small dilator in through the transfemoral area and clean the nerves, and that simply means that we are not creating other problems which may lead to slow wound healing later because of the scar tissue. Last but not least, it is very fast because you have not done bleeding, you have not taken a lot of stitches, and the patient is practically pain-free. In a few hours after surgery, he is ready to go home. So patient starts walking in few hours after the surgery, and most of the times when the pain is because of compressive issues, the patient's pain is gone by 80 to 90% immediately after surgery. So when patient is there because of slip disc or because of cervical radiculopathy, the patient's results are almost instantaneous to the level of almost unbelievability. So that is why these surgeries have revolutionized the treatment around the world, and we get a lot of patients from almost 22 different countries flying to us for relief, and the results are fabulous. The cost of surgery is relatively low because you don't require long anesthesia, long stitches, and the hospital stay is very less. Patient acceptance and rehabilitation is ultra fast, and patient is ready to walk and on his legs very fast. So I believe as of 2024, when I'm recording this video, this is the fastest and the latest technology available for the mankind in terms of spine surgery. And very important, before endoscopic spine surgery, a lot of fusions were done because you have to do a wide lateral decompression, which will make the spine unstable, because you are doing the decompression with the instruments which can't go in, but you have to take out a lot of bone for clearing the nerve. Nowadays, many fusion surgeries are avoided with the endoscope because we can actually go inside the vertebra and do the undercutting and do the cleaning of the tissues without damaging a lot of bone, which allows spine to remain inherently stable. So you don't have to put the screws all the time and make the fusion surgery unless and until it is unstable before surgery itself. So if you have a spine problem which is primarily because of stenosis or nerve compression and there is no instability, there is a high chance you can get away by doing an endoscopic spine surgery with a very good result. I hope I was able to clear out some doubts about endoscopic spine surgery. If you have those kind of problems, please consult a doctor nearby your area who is into endoscopic spine surgery regularly. If you have any doubts, you may send some queries on my number given below. I will try and answer those queries as soon as it will be possible, though the workload is that sometimes we require a couple of days, we could really answer your query. So don't mind. I trust that endoscopic spine surgery is the future of spine surgery and you will get great relief. I pray to Almighty that whatever problem you're suffering related to spine will soon vanish, this way or that way or whichever way. I trust God that your pain will go away, and I believe that God blesses us with all the pain relief for everyone.